try and direct them towards the seat. I think there's some on the sides. Front row is filled up. I'd like to see that. I'm Justin Lodge. I'm a physical therapist here at Wright State Physicians. We work down in the first floor. We call it the basement because we actually don't have any windows down there. It's all right. We don't mind it. You just don't know if it's raining or snowing or anything until we go back outside. I've been working here since July. It's been excellent. I've loved every minute. This is the second lecture I gave. I gave another one back in October about exercise. I think the website, we have access to the website in the packet. They have the website there. You can watch that previous video that's already uploaded on there. Today we're talking about determining your foot type, what type of shoe works best with your foot type. Professionally, this is a general talk. To give an actual professional diagnosis of what your foot actually is doing, I need hands-on evaluations. This is kind of more of a general talk, generally, for what type of shoe works better with your foot type. So for advanced things going on, that'll be more of a hands-on evaluation that we can absolutely do. We can talk afterwards if you wanted to set something up for a more individual session. Again, medical disclaimer, anybody that has something else going on that you've already had talking with your doctor that's told you something different, listen to them. They know more better what's going on with your foot, your situation than I do. I haven't had a chance to evaluate it yet. So today, basically going over the basics, going over a little bit of what the foot is, how it works. Determining your foot type, there's a really simple test that you can do at home that can give you a general idea of what type of foot type you actually have. Breaking down the shoe anatomy, what actually is in the shoe, what types of shoes there are, what type of shoe works better with your foot, and then maintenance, proper fit, some training tips, and then at the end, there's a website that I've given. It's actually from a podiatrist website. It gives you every brand of major brand shoes. It's like Nike, Adidas, New Balance, Asics, Brooks. It gives you actually, so if you have like a certain type of foot you have, it'll give you what brands or what style to get of that shoe. So it's a nice little resource you guys can use at the very end. So basically today we're going to talk about the foot. This is a nice model I borrowed from the athletic training room downstairs. It's pretty amazing how this thing works. Combination of 26 bones, 33 joints, and 112 ligaments, and we just take it for granted every day and beat up on it, walking around, not even really thinking about how amazing it is. Synergistically works when we're walking and running throughout our normal day. Basically what you want to do before you enter any type of program, again, determining your foot type, determining what style of exercise you want to get into, because there's a difference between walking and running. Those are two different forms of exercise. So basically when we're walking or running, we're controlled falling. That's the way you really want to look at it. So you got to determine what this needs to have the most support. So again, this is the foot. At one point in time, actually I see one of my old classmates back there. Hey, Megan. We knew all this. We knew exactly what every single one of these nerves and ligaments and tendons and origins, insertions, everything. Retained most of it. There's still a little bit that might be a little bit foggy in there. But again, this is the bony structure, the bony form in there. Basics. Before you get any type of walking or running shoe, you want to make sure going over any past experience you have with the shoe. If you wore Nike and you're like, I hate Nike because Nike has a really narrow base, don't go buy a Nike running shoe or a walking shoe. Current problems that you're having, what things do you tend to notice on your foot that you have problems with? Biomechanical needs, whether your foot, I'll go over in a minute, whether it's overpronated or oversupinated, or if you have a neutral foot. Environmental factors, if you're going to be doing any off-trail walking or jogging, you want to make sure you have some good tread and some good control on the bottom of the shoe. You don't want to have something that's not waterproof because you tend to run into some more wet areas when you're going off the trails and off-road. Running, walking, and racing requirements, obviously those will be something we'll talk about a little later on. Hopefully we're not talking about this type of foot. I don't know if anyone in here has this type of foot in here, but if we do, I think we're in the wrong lecture. So this is the very easy test that you can do to find and determine your foot type. It's very simple. Just get a simple cookie sheet or something like that. Fill it with a little bottom layer of water. Next, obviously, you're going to put your foot down into the cookie sheet of water. Make sure you have like a shopping bag or a paper towel or something that you can utilize afterwards, and then you're going to put your foot down on there. Don't step too hard, but enough to at least make an imprint on there. Kind of like when you're walking in the sand on the beach, you can see the imprint of your foot. And then obviously step off and you can see your foot type. This is the easiest, cheapest way to do this. Again, it's generalized. They have $1,000, $10,000 equipment that will analyze your foot. Probably you've seen it at Walmart, some of those things you see on the New Balance thing you step in. It's probably about as accurate as that. I've done that before. I was kind of curious to see how that actually worked, and I've done it, and I did it like 2 or 3 times in a row, and it told me 2 or 3 different types of shoes and inserts that it recommended. So to say that it's accurate, I don't know how accurate that machine is. This one is, I mean, it's decently accurate as far as giving you a generalized foot type and a generalized form of analyzing your foot. So once you've done those simple steps, so this is our at-home version of determining your foot type. You can see what type of arches we're going to have with our feet. So first, most people fall into this category with a normal arch. You're going to see a little bit of what we call, again, pronation, where your foot tends to roll more inward. Not a lot. So you want to make sure that, again, if we're in more of this category down here, where our foot, or actually the mid part of our foot is actually touching the ground, or we're more in this position. That's what we call overpronated. And there's a second type of foot that rolls more outward this way. It's called more supinated. So we got neutral, pronated, overpronated, I should say, and then supinated, where it rolls more outward. You can kind of see, again, supinated here, pronated on this side here, and then more neutral. Other things you might want to consider is your overall, the weight that you're going to be putting on the foot, again, your biomechanics, and how much you're actually going to be wearing the shoe. We'll go into some of that later on as far as when we need to change our shoes. So talking about most of the population with a normal arch, this is going to be really groundbreaking and earth-shattering. If you have a normal arch, you can pretty much wear any shoe that you want. If you want to, you can have more of a little bit of what we call a stability shoe. Going over here, I'll pass these around. I didn't wash them. But if you want to look at them, that's fine. I can hold it up here. But if you want to feel them and kind of feel what I'm talking about, I'll pass them around. If you want to pass, just say no. Keep them away. More of a stability shoe. These are actually all my shoes. As you can see, I used to be a runner at one point in time. Since my wife and I have had a baby, I haven't had too much time to do any running recently. But these are all different types of shoes that I've tried depending on. I have more of, again, a neutral foot. I've overpronated a little bit. So again, that's something that I've had analyzed, and they told me exactly what's going on. So a professional actually told me exactly what was going on. I can't give myself a diagnosis of my own foot. You can only give the generalized what we're talking about with these tests. So stability shoe has, again, as you can see this, there's a little bit more of a firm arch in the middle. So like when you twist your shoe, a stability shoe, there's a little bit of give. There's not a whole lot, but again, when I'm pressing pretty hard. There's at least a little bit of stability in the middle part of the shoe. We call this part the midsole and through here. Do you guys want me to pass this around? Do you guys want to feel this? Yes, no? Okay, I'll start over here. How are you doing? What were we talking about? So for more lightweight runners with normal arches, sometimes they'll prefer more like a neutral cushioned shoe that doesn't have too much added support into it. That one has a little bit more support than the one that I'm about to pass around. This is a little bit less. I mean, this has a little bit more give to it and a little bit more bend. So if you want something more like lighter for more performance, like if you're trying to do any type of like 5K, 10K, you want an actual little bit more lightweight shoe, this guy is what we're talking about. So the next two type of feet that we're going to be talking about are really what this talk is guided towards, making sure that these feet get the shoes that they need. So first we're going to talk about the overpronator. So the person with more of a flat foot, where the arch is more collapsed down to the bottom of the, towards the floor. We need support. That's number one. Something that's going to stop that foot from going down that direction. So you want something that has a nice firm arch in the middle that doesn't allow this foot to roll down towards the ground. And actually, I was looking around. Does anybody have any New Balance in here? Any New Balance that have pretty strong, firm arches? I don't have a motion control or like a stability shoe. That one's not bad.
But I had problems, so I put.
You have the orthotics in there?
Yeah, I do. I had flat foot. That's what doctor said. So he said I had to put.
So that's not a bad shoe, actually. Do you mind can we pass your shoe around? You sure? Can I pass the shoe around?
Sure.
We'll give it back to you, I promise.
I'm not walking.
All right. So this is a little bit more what we call like a stability shoe. This one's pretty firm. She's actually got, she could use a little bit more support. No, that's fine. We'll keep it in there. This one's not bad. We'll pass this one. We'll give it back to you, I promise. Did I leave my clicker? There it is. So again, talking about the overpronation, so the foot that rolls in more. And he got one too. Yeah, this is a good one. This is more what we call a stability shoe for more overpronated feet. This is a good one. You might want to invest in some New Balance too. I don't work for New Balance or anything. I'm just a little spot there for them. This is a good one. I like it. Can I borrow this one? Sure. Do you mind?
No.
So that shoe we're talking about a little bit more for an overpronated foot that collapses down in there. You don't want a lot of motion. You want something that stops the motion. Because again, your foot's rolling in there too much. Actually, we're talking about, okay, so again, more of a flat footprint when you do that wet test. Your foot's more flat. You don't really have an apparent arch there. So again, we're talking about stability shoes, something, if you're going to go out and buy shoes, you want something, again, dual density midsole. These are things to look for, some key words if you're going to be buying some shoes. Dual density midsole, different types of supported posts, things that prevent that foot again from rolling in. Motion control shoes, like, what was your name? Louis. Hey, you definitely got the right shoe. Those are nice. Very good. And also too, as far as weight goes, if we're a little bit heavier, sometimes adding those motion control shoes really can make a big difference. So again, we're talking about overpronation when that foot collapses down in there. For arches are collapsed down to the floor, like Louis' shoe, the one she has back there, that's the type of shoe definitely that would benefit from. Another thing I want to point out too is not only, just because you're an overpronator doesn't mean you're going to only have pain down in the feet. But also you can see where we can get this inward rotation at the knee. So as our feet roll in, our knees start turning in, our hips start turning in. And it can be one side or the other, but usually it's commonly both. So you can start wearing out the inside compartment of your knees. So sometimes I'll have somebody come into the clinic and they're like, well, I've had knee problem on both sides for 30 years. And I'll be like, well, have you ever had a shoe fit evaluation? Have you ever been able to look at your feet? And I look at their feet and they're collapsed down right on the ground. It's like if someone had caught that 20 years ago, we might have had another 20 years left with these knees. Sorry, I keep drinking this water. We had Max and Irma's earlier, and I'm like dying of thirst. All right, so this is the opposite. This is more of what we call the high arch. So more we call not a overpronator, but this is a underpronator. So again, pronation is more this way. We're going more that way, or what we call actually supination. So really you have a rigid foot. When you roll outwards, your foot becomes way too rigid. So we need a soft shoe. You need cushioning. So as an overpronator, we need support. The opposite end of the spectrum, if you're a supinator, you have a high arch, you need something more with cushioning, more support in there. And that's obviously we were talking about to absorb the shock of your foot. So we talk about more neutral cushioned with a what we call a curved last. We're going to go over different forms of last shapes and what foot works better with the last, and we'll explain what that is. If you have this type of shoe, or this type of foot, you want to avoid stability or motion control because we want your foot to actually pronate a little bit more. We want that cushioning to be there. So if you have a supinated foot, the shoe like Louis had, you don't want that shoe. You want a shoe more something like this guy. So it's got, you can see how much it builds up that arch right in there. It's very soft, it's very cushiony. And again, you can see you can bend this shoe. I mean, you can bend this shoe really easy. It's very, very, there's not a lot of support in there because your foot's already too solid. It's got too much support. You need a soft shoe that's going to cushion the blow. So then that's kind of what that supinated foot looks like, rolling out more that way. This is kind of fun. You can kind of look at your own shoes when you get home, or if you want to look at them now, different wear patterns. You can kind of tell what your wear patterns are based on where your foot is. So a normal wear pattern, everyone's going to wear out on the lateral side of their foot because when they're walking, not a lot of people walk inward like this. They don't walk with their foot on the outside like this. Everyone usually strikes lateral heel when they walk, so they're usually rolling in this way. So normal wear patterns are from the outside of the heel, along the front, down into the middle here. So this is more like a normal wear pattern of a shoe, right along that way. More of a supinator or overpronator, the one that rolls out. You can see the lateral, it'll be more on the lateral side of the shoe. So this is kind of the wear pattern you'll see with those supinators on the outside. Same thing with the opposite. You're going to see more of the inside wear for the overpronators, more on the inside this way. So we talked about the different lasts of the shoe. It's basically the map or the kind of the layout of the shoe. So people that have flat feet with that shoe you had, again, it's almost like a straight line from back to front. There's no curve, there's nothing to it. The first one we passed around, I don't know where the first shoe went. Oh, it's up here. This is more of kind of a semi-curved, so more for a normal foot. Someone's kind of right in the middle. And we have more of the curve. This guy has more of a curve to it, and so does these two have more of a curve. More of a curve last. You can see the difference in those shoes. They're more curved, more C-shaped. So we talked about the flat feet, straight, more here. Most common neutral foot, semi-curved, and then actually a curved last for the high arch supinated foot. Just looking at basically we're going to go into more of the anatomy of the shoe. So we talked about the outer last, which is actually just the kind of the makeup of the shoe. We're going to go towards the inner last, which is actually, I'm going to keep passing the shoe around. It actually looks more like a sewn-in moccasin kind of feel to it. You can actually see the stitching kind of right on the inside of this shoe. I don't think this one does. Yeah, both of these do. So this is what we call a slip last. Let me pass these two around. You can look at the insides of them. Whereas again, that's more for the high arch supinated foot. Typically, that's not something you can choose with. That's just what the shoe is usually made with. And then the board last, which like Lou's shoe, it's going to be more of a board last. It's actually going to be a piece of material in there. It's not going to be just the sewn-in piece of fabric like those. Most of them nowadays are the combination lasts. Has more control in the back, so it'll be partially like a board like that, and then partially in the front has more motion in the toe box for the slip last in the front. So we talked about the outer lasts, which kind of it's built upon. The outer sole is really for the running shoe. Is kind of the tread of the bottom part of the shoe. And I brought again one of my old basketball shoes. You can tell for the running shoe, all of our tread is going in one direction. It's all for forward. It's all for sagittal plane, kind of one plane motion. Whereas like a basketball shoe, you can see all the different lines and variations. It's more for side-to-side kind of cutting, running in different directions. Don't run in these. Don't run in a straight line with these. They don't work out well. Their traction is for side-to-side movement. A running shoe, the tread is all in one direction. So I'll pass this around too. And kind of look at the difference in the tread. And then we talked about the upper. Sorry, hang on a second. The upper part is basically just the part that you actually, it's the designer part. It's the part that everyone is trying to really look really cool, different designs. So it's basically the part that just makes up the top half of the shoe, where the laces are at. This is actually another good example of a shoe for a supinated foot, someone that's got a high arch. You can see how, again, how it builds up that inside part right there. You can. It just depends on, again, that's more of a individual situation. You can be a supinator non-weight bearing, and then when you weight bear, your arches collapse. And that's where you have to get, again, a professional evaluation to get more. That's kind of when we run into the orthotic side. That's where you get more of an orthotic to correct, because you have different foot types in different situations. And that can probably be a whole other hour-long lecture that I always do this. I always walk myself into these hour-long lectures from my hour-long lecture. Yeah. So actually, you guys are going to be more informed than probably the people at the shoe department. So you're going to have to be your own advocates when you go in there and say, I need this, 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 and this. And they're going to be like, where did you come from? The breathable part on the top part right here, this is called the vamp. So if you want a breathable vamp, if you're going to be doing a lot of running, jogging, or long walks, things like that. Other than that, some shoes, I mean, most shoes that I've seen now, they at least have a little bit, even if it's leather on the front, they'll have a couple little holes. And that's your vamp. That's kind of the breathable part of the shoe. These are actually what I run in now. We're going to be talking about, again, for the overpronators, there's three key elements that you want to ask when you go to buy your shoes, and we're going to talk about them right now. First one is called an external heel counter. More for a runner that overpronates. It's going to stop that initial pronation at the rear part of your foot. So, and again, we're going to talk a little bit about, and a little later about proper running form. This is talking about external heel counter only works if you're a heel strike runner. If you hit your heel first, your foot will roll inward really fast. That's what the external heel counter is actually for. It's this part of the shoe back here. It's this little plastic piece in the back right in here. I don't actually have an example of that one. This shoe on this picture has it. But again, it reduces the initial overpronation with the heel strike first. And we're going to go over in a little bit on why that's detrimental actually doing heel strike running form. We're going to talk about that in a little bit. So that's more in the back. So it basically stops this part of the heel. Whenever your foot hits and rolls in, that's what it's preventing it from doing. Next is the stability post. Again, that's more on the inside of the foot, more here. And that prevents that foot from rolling too far down this way, inward. So it's going to kind of stop right here and prevent it from rolling down. Stability posts. So again, when you go in there, actually I think the one you guys have right there, that actually is the Brooks has the diagonal roll bar in that one, in that black and green one. But different trademarks, they have different names. Graphite roll bar, diagonal roll bar, foot bridge, bridge support, just something when you go in there looking, you're asking somebody, ask them about stability posting. Again, if you're an overpronator, if your foot rolls in too much. So there's that stability post right down in there. Next is we're going to go into about this midsole of the shoe and when you should really replace the shoe because the midsole breaks down pretty regularly after using it. So another key word to use is dual density midsole. That's another one. That's another word of the day that we're going to take home. So usually when you look at a shoe, especially some of the New Balance shoes, and actually ASICS makes a nice two-tone dual density midsole. They'll usually have two different colors. They're always gray. There's a lighter gray and a darker gray. The darker the gray gets, the more firm the midsole is. So I always think the darker, the more firm it's going to be. Again, this is all for an overpronated foot. So talking about the dual density right here. It's right in the middle. You'll look for it right in the middle of the shoe. So we talked about, again, that midsole is that same area we were talking about, right down there. And then the sock liner is just that removable part. I mean, it really just makes the inside of the shoe more tolerable. It doesn't really add a whole lot. When she was talking about more of the orthotics, you want to make sure if you're going to buy a shoe, it's a neutral shoe. That's kind of one of the big keys I did want to say today. That might lead me to my next talk. If you have an overpronated foot and you're going to put orthotics in it, and you have a stability shoe already on top of it, it might correct too much. You want to have, because when you're measured for your orthotics, it's more on a neutral plane. So if you're going to have an overpronated foot plus an orthotic plus a stability shoe, it might give too much stability. So that's kind of another thing you want to think about is making sure it's a neutral shoe first off. And that's, make sure this comes out too. You're going to have to put it on top of this. Don't anybody be stealing my sock liners out there. I need those. All right, just recap. So foot structure, going back to our wet test, making sure when we figure out what type of foot we have. Function, do we over or underpronate, making sure, or do you have a neutral foot, making sure we have the proper shoe for that foot. Body type, weight, to make sure if we have the proper support if we're an overpronator. You get more and more of those stability shoes. Environment and regimen, how often we're doing it. Again, this is going to it's kind of just again reiterating what we're going through. Talking about cushion shoes was kind of that first shoe that I passed around. I don't know if I see it out there anymore. It's somewhere out there. So more for supinated shoes is that kind of the white one there. For people that underpronate, so supinated shoe is a cushioned shoe. Motion control, like Louis had, it's going to be more for overpronators, people that are a little that have low arches. Stability shoe is more of the moderate foot. Like I was talking about, I have a little bit of overpronated foot, but you're more of a neutral foot. You don't have a high or a low arch, but you do want to add a little bit of stability into it. So something that gives you a little bit of stability, but also gives you some of the free form of a flexible shoe. Performance and trail racing we had, I brought some around. The one New Balance shoe, I think it's this guy right here, more of a performance lightweight. So if you really want to cut down your times, you don't want your legs fatiguing, lightweight. I mean, this guy weighs it's like maybe 8 ounces, 10 ounces. We'll get to this guy in a second. This is another one of those crazy ideas that somebody had that they did well with the idea, but there's just, I'll get to it in a second. So make sure that you're, efficient with your foot. You don't want to go and put this. If you're an overpronator and you put this shoe on, you're going to make it 10 steps and you're going to hate yourself. This does not offer enough support for someone that's an overpronator. Again, trail shoes, someone that's going off-road, you need a rugged outsole, something that can grip the loose ground. You're not running on asphalt, you're running on dirt or leaves or twigs, plants, things like that. Low to the ground for added stability. And water resistant helps. You want to get those wet, muddy shoes. In general, talking about the two types, flat foot or high arch, those are some of the key words to really focus on when you're looking for your shoes at the store. Make sure, most of the stuff out there, show business. Make sure you're about the shoe business. That's what you want to go in there, well educated, which hopefully this helps everybody when they're going back in to buy their next pair of shoes. And then I say you have to go out, like the shoe you're wearing now, you don't have to go out and buy another new pair of shoes today or tomorrow. When it's time to buy a new pair of shoes, at least you'll be a little bit more educated. Big thing down here, skip the bells and whistles and the fads. I mean, there's some shoes I've seen out there, I'm like, I don't know, I saw those new Adidas Blades. Have you seen those things? They have like almost like a springboard on the bottom of them. I'm like, I get what they're trying to do. It's just, I don't understand it. I think everyone's got a handout on this. This is my next kind of soapbox. If you want to pull that out and to look at it, I think there's a handout in your packet. Everybody wears, well, not everybody. I hope everybody doesn't wear high heels. I don't wear high heels. I think maybe I've tried on my mom's back when I was little or something. I don't know. The main thing is, I know that some works require women to wear heels to work. If you have to, try to get a lower heel. This is the biggest thing. The pressure on your forefoot when you're walking with a 1-inch heel compared to a 3-inch heel, I mean, that's 50% more of your body weight is put on the forefoot. So walking like this for 30 years, these are some of the things that can happen. So obviously we're changing our posture. So first we start off high heel. This is, I don't know, these are the new, I don't know what brand of high heels those are. Bringing the knee anterior to the ankle, going to cause more knee arthritis, patellofemoral issues that go on. Obviously, then we're going to have the sway back here, and then again more of that forward head posture. The body compensates in the most amazing ways, and you'd be crazy. It's really crazy to see what people come in with. Bunions, and especially bunions, and then Morton aroma, and then hammer toes. It's that closed toe box. That stuff is, you don't want to mess with that stuff. The surgery is not fun. Has anyone had bunionectomies or bunion surgeries in here? They're not fun. You've had both of them. High heel wear in the past, and you have nice shoes on now. Perfect. See, success story. Good job. So you can take it from her. You don't want that. I mean, for occasions, yes, it's fine. You're going to a wedding, you're going to a ball, some fancy dinner, it's fine. Try not to, and if you do wear them, try to get the high heels that have more of the open toe box. Don't get the closed toe box. That's the biggest thing, is the pointy toes. Guys, you know what I'm talking about. No, I'm kidding. Is anyone wearing these shape-ups?
I don't find it comfortable.
Yeah. I don't know if anyone has known this. They recently had a $40 million lawsuit in Skechers because they're false advertisement. And actually that people that have overpronated feet causes them to overpronate more because you're bringing their heel farther up off the ground. Also people that had balance problems, they can't feel the ground that they're walking on. So any of your friends that are wearing these, tell them I said, it's no, it's bad. Even though Kim Kardashian and Brooke Burke and Joe Montana, they're all wearing them. It's because they got paid probably $10 million to put those shoes on. But if you haven't got your refunds yet, you had to do it by October 13th. Sorry. The next idea or more recent running adaptation that's come about is barefoot running. Show of hands, everyone's heard of barefoot running. Have you heard of the new idea that's come about? Some pretty interesting research that they did. I think it's John Lieberman was the guy that kind of really revolutionized this thing. He was studying some runners out in, I think it was either Kenya or Africa. And obviously they're not wearing shoes out there. They're running, and they're running more on the balls of their feet and on the fore part of their foot. So instead of what we talk about when you're running, instead of doing that heel-to-toe run, they're running more, they're landing more here first, more on the front part of their foot or on the mid part of their foot. And what they actually really found was pretty amazing on their the ground reaction forces, the actual force that's transmitted through the foot when you run. Heel first, you get this initial spike, which is pretty, I mean, that's significant. Here, this is running barefoot without a shoe on. This is running heel strike with a shoe on. But you're hitting your heel first, you're getting this initial strike here, and then you're getting the rest of your weight back on the foot. Doing more of a forefoot or a midfoot strike, it's just a constant flow this way. Basically what you're doing, when you hit the heel first, you're sending a shock wave basically back up the leg all the way into your hip and into your lower back. So you're basically landing like that. if I'm running more on my forefoot or my midfoot, I'm landing soft. It's more soft this way. So it's a lot softer. I'm going to show you a video in a second that'll kind of show you the translation of the force. I hope the sound works. We'll see. You can kind of see the actual, this is per impact force for body weight. So if 100% is your body weight, this is actually 1.89 with the running barefoot without the shoe on, hitting your heel first. So you're actually 1.9% or times your body weight through your heel. That only lessened it by like 15 or 0.15 or so down here, and then actually running barefoot lessened the amount of impact through the rest of your body that you're feeling, which is.
So least impact is better?
Yes, lower impact is a lot better, yes. So let's see if this guy works. I heard the bing before, so that I think the video is going to work. Yeah. What is it? Chi running? No. Is that's something I should? Oh, hang on.
Why midfoot striking is?
All right, chi running. Let's fill us in. What is chi running? Okay, so it's more forefoot. That's what this video is basically going to do. So quiet feet, running more on the midfoot. This is what this video is going to compare.
We're just going to kind of breeze through this real quick and show you the difference between the midfoot and the heel strike and what that's doing for you. It's really just increasing your shock absorption properties. So if we stop, we back up a little bit. We watch when that foot comes in contact with the ground. The toes are pulled up, the knees straight. And really what we're looking at here is the ground's going to come in and it's going to contact with the back of the heel, which is essentially going to slap that foot to the ground. Now what happens here is you have the front of the shin that's really controlling that. That's where a lot of your shin splints come from. But if we look at the overall ground force and what that's doing to you is it's pretty much just driving you backwards. Look at how that arrow is tipping backwards. So really what we're trying to do is we're trying to initiate better shock absorption through our body. And when we land on our heel, we're just pretty much crashing into the heel, and then that whole force is just driving up into the knee, into the hip. So what we need to do, we need to initially, the second we touch the ground, we need to gauge our shock absorbing properties of our muscles, and that's what we're going to look at doing. So we can just watch them come through. You can see how it's planting those heels big time. We need to engage the muscles to shock absorb. So if we watch them come through now, you're going to see the foot strike's a little bit different. This is after working with this individual. But if we watch him come through, now let's take a look and see what the ground's doing to his foot and ankle. You can see how the foot's facing straight ahead. He's not pointing the toes down, landing on the ball of his foot. That's really important. A lot of people feel like they have to land on the ball of the foot. But as he comes in contact with the ground, you can see his contact point now is in front of that ankle joint. So really, the foot's getting pushed up, which means that the calf is going to turn on. And think about the shock absorption properties, or not the shock absorption, but the strength of the calf versus the front of the shin. The calf is much stronger than the front of the shin. So the second we touch the ground, we're going to be catching all of our weight with that. The other thing we're looking at here is look at how bent his knee is. So as he's coming here and here, it's a nice bent knee position. So as that ground pushes up into him, it's just trying to spin at the hip. It's trying to spin and hinge his knee, and he's not going to be taking that huge ground reaction force backward. So we talked about.
So that's the basic key that we wanted to get with this, is making sure that when all right, we're back on. The forefoot strike is you can activate the posterior chain. So your basically your calf, your gastroc muscles, your quads, your hamstrings, and your glutes. You're activating all those at the same time, and it's a lot quieter. If you hear somebody run on the treadmill, I can tell if they're a forefoot striker or a heel foot striker. It sounds like the Clydesdales running on their heels. It's just very loud. Think of if you're going to be getting on the treadmill and running. Again, this is people that are running is trying to change from a heel strike to a midfoot strike. It's difficult. It takes a lot of practice, and to actually to train those muscles to do something that you really haven't done. Because I was a heel foot or a heel striker probably up to I was maybe 19 or 20 years old. I've only been running like this probably within the last maybe 7 or 8 years. It definitely makes a big difference. I don't have the knee pain, the hip pain, things like that.
Would that translate into walking also?
No, that's the difference. Walking is a different story. There's a lot less ground reaction force when you're walking. You're basically not really increasing the amount of your ground reaction force when you walk. So this just applies to running. This doesn't apply to walking. It takes a lot of practice. Yeah, you like literally. Don't do it on the treadmill first. Do it on the ground and work on just working on. I mean, doing it slow motion. I mean, you can just do it this way, and then just work on building yourself up and starting really slowly. That's the key. I mean, if you're used to doing running 4 or 5 miles, start with 400 or 500 feet, and then build yourself upon that. That's the way you really can get on that way. Yeah, you can get shin splints walking if you're going again from no activity at all to walking, or if you're walking more downhill where you get that foot slap a lot. If you don't have a lot of control that way, so yeah, you can get shin splints walking. Yeah, not as common as running, but yeah, you can. Oh yeah.
What if you teach yourself to land on midfoot walking? Would you prefer that as opposed to wheelchair?
The question was, would you prefer doing more of a midfoot in a walk? The ground reaction force isn't as much when you're walking as when you're running. I don't see a need to do it that way. I don't think you need to do it that way. No, not for walking. For running, definitely. Yeah, heel to toe walking. More running though. This is the newer data that's come out is more of a midfoot and a midfoot strike first. Your heel does come in contact with the ground, so you're not running like this. Your foot does come down, and then as you can see when that guy was running, his foot does come down. So this is kind of a demo, but you can try this at home if you feel like you can do this. But trying to jump, I consider running again like controlled falling or controlled jumping. When you're running, you're jumping. So if you jump and land on your forefoot and your midfoot, or if you jump and land on your heel, did you hear the difference? When you jump in, and that's just a lot more shock that you're absorbing through your body. This is an interesting thing that this is 2012 men and women's Olympic 10K competitors. Almost 2 to 1 now run more forefoot, midfoot than they do on a heel strike. I think that was kind of a nice showing you what the professionals are doing. They're changing their stride to more. What I should have done is look back to see if they had any data back from the 50s, 60s, 70s, 80s up because the modern running shoe, Nike's only been around since the 60s. They came out with that waffle cone for the impact of the heel. We've been running more of the midfoot, forefoot, and then Nike came out and changed the whole game. We should call them up. Go over to Oregon and see what they got going on. But I thought that was kind of an interesting slide. Faster, sprinting on your feet, all sprinters. No sprinter, I don't even think sprinters, your heel really even touches. Sprinters, like the 100-meter sprinters, they're always on their toes. It's faster, it's more efficient. Distance runners, like we talked about the 10K, some are still running on their heel. Sometimes it's just too hard to change. And that's what the next slide's going to be, is more the forefoot. Sometimes your body just can't adapt to it. So if you try it and you start feeling, any type of soreness and pain, as long as you're progressing slowly, your body just might not be ready for it because you've been going at this for so long, you've just adapted to it. If it's easy if you can get it started early, that's the thing to catch. Again, talking about, I'll pass this. Did I already pass the, no I didn't. This was, I'll tell just a short, quick story. We're doing good on time, right? We got 15 minutes. I used to run in these, and then I hit a rock, and I stopped running in these. So that's the short story. I did, however, they're good training shoes to really, if you try to run in your heels on those things, it hurts so bad. Those force you a forefoot, midfoot contact. That's what I liked about those as a training device to really get into that midfoot, forefoot strike. If you try to hit your heel when you run on those things, it doesn't feel good. So progress slow. Adaptation, it took me, I was pretty good when I started running with those. I could do like 4 or 5 miles really easily. It took me up to like 12 weeks just to get up to like a 2-mile range when I was running. It takes a long time to allow those muscles to change and adapt. I was so sore the first couple times I did it just because you're completely changing the way that you've ran for so long. And again, last thing is really, evidence shows there's no real evidence, there's not enough research out there comparing regular running, long-term benefits, long-term results compared to They haven't done enough that it says one is better than the other. It's based on how you feel like you can do it. I prefer more of a midfoot strike. I really think that the mechanics just make sense. I mean, it's just softer. I mean, it's softer when you're talking about running. The ground reaction forces are just too much. And I mean, I wish I'd have known about this earlier, to tell you the truth. All right, talking about the breakdown of the shoe, we'll kind of go through this one a little bit faster. Life expectancy of a shoe is 6 to 8 months for the midsole. So talking about the midsole of the shoe is, again, this middle part right here where most of the shock is absorbed on the inside. 6 to 8 months or 600 to 800 miles, depending on which one comes first. 600 to 800 miles, that's a lot to do in that short of a time. And that's, yeah, so if you walk 10 miles a day, I mean, once you get up to that 600 to 800 miles, it breaks down that fast. Even if your tread doesn't, your tread will last longer than your midsole does. So that's another thing to work. And if you are buying, like you like a certain pair of shoes, the midsole will break down if you're not even wearing it.
What does that look like when it breaks down?
No, it doesn't absorb the shock as well. So it'll look the same. It's just when you're walking or running on it, you'll feel the difference. It doesn't feel as supportive. Like when you put a new pair of shoes on and you're walking around, you can feel the difference to where like you put it on an old pair of shoes. The support in them is a lot better. So that's kind of the general, the rule that they've come about is to really see how much it breaks down. So again, if you have a shoe sitting up in a closet that you haven't worn, the midsole is probably worn out. This is more for someone that's exercising every single day. They're running 4 or 5 miles every single day. I mean, you said you're walking 10 miles a day. It still does break down. It does break down that quickly. This is a nice picture. This is actually an electron microscope that showed the breakdown of a new midsole. Look how the air can pass through there. A lot of cushioning, a lot of support in those holes down there. And as it breaks down, you can see those holes start getting a little bit smaller, so it actually compresses down. These are the mileage. So this is a new one. This is about 500 kilometers. This is 750 kilometers. So if you are exercising daily, I'd recommend 2 shoes of the same pair, because the EVA, the ethyl vinyl acetate, is actually what's made up of this midsole. It needs 36 hours to recover to its original support. That'll maximize the amount of time and wear you can get out of your shoes. So you got 2 shoes, you're doing 10 miles a day. You're only putting 10 miles every other day on your pair of shoes. So they last you a little bit longer. Again, like I was talking about, the sole will wear out a lot less fast than the actual midsole. So your tread will still be on there, but your shoe actually is wearing down. Don't use the shoe goo. I've seen it. Your shoes are. It's time to get a new pair of shoes at this point. At least a half of. I usually use my thumb. Half of your thumb. Make sure you got enough in your toe box. If you don't want to get that black toe. I used to do that. I played soccer a little bit, and I got my big toe. I've lost my big toe so many times because you want a soccer shoe. I don't know why we have this thing in our head. We like small, really tight soccer shoes. I don't know. And I always had that black toe on my big toe, just because I always wanted my foot to be really, really compact in there. So make sure you got enough at the end. Don't do as I did. Make sure the width is wide. Again, so in general, we talk about the New Balance. New Balance usually has a wider foot box or front of the foot, whereas Nike is a little bit more narrow from what I've seen in the past. Try them on. Make sure. I mean, if it feels like it's too tight when you're wearing it, just when you put it on, it's not going to feel good when you tie it up. Just make sure you tie the shoes up. See how it feels. So it shouldn't be uncomfortable. Lacing, make sure, like if you're going to go out for walking or running, that your shoes are actually tied, not too tight or too loose. Socks, don't go running out with your thick woolly socks. Make sure your socks are breathable, that they actually wick moisture away. Keep the feet dry as possible. Yeah. Yeah, I mean, you can use any type of talcum powder. You can use Gold Bond, things like that, just to keep the feet as dry as possible.
Before you go out and exercise?
Yeah. Really? Yep. I mean, and you can do it afterwards, too. I mean, and it also cuts down on that smell. Again, any type of training that you're going to start to do, always start easy. Depending on your cardiovascular fitness, you should be able to pass what we call the talk test. You should be able to go out and walk with somebody, or even if you're alone, get somebody on your phone. You can talk to them. As long as you're not out of breath, you're not walking too fast. As long as you can carry on a conversation, that's a good walking or running speed. And this is that website I promised everybody. I like this website a lot. It actually gives a breakdown. So again, like Adidas, if you needed a cushion or neutral or a stability or again some competition racing, ASICs, cushioned, motion control, max support. So I like this because you can say, my foot's this, I like this brand, I want to get this shoe. It'll actually tell you exactly what it is. And I think that is it. What questions do we have? I know there's going to be a lot of good ones.
How do walking shoes differ from running?
The question was, how do walking shoes different from running shoes? And it's the makeup of the midsole. The midsole of the shoe is different. Again, we talked about the dual density midsole. Things that have more cushioning, it's going to be a thicker midsole and have more cushioning. You're going to see more of the walking shoe is going to be adaptive and more soft. That doesn't allow for more of the midsole cushioning. There's not going to be as much midsole support. You kind of have to go in. I don't really know as far as if you can go in and ask specifically at the shoe stores, like, hey, I want a walking shoe, I want a running shoe. I would just go with the one that if you need more support, go with more of a running shoe that has more support for the foot that's going to collapse. If you need a softer shoe, get something, again, that's going to give you more support. That's a lot softer.
So you do more pronation?
I'd rather do that way, yeah. I mean, I think you'd be fine going. I'd rather just do more bang for your buck. I would just go with a running shoe. I mean, it's going to give you more of the support that you need. Mm-hmm. There's a question. Yeah, the question was, she went to her doctor, and I'm repeating this for the camera. I know everybody, if you heard her. The question was, she went to her doctor. You had a sore spot on the bottom of your foot. You thought it felt like a cyst. It felt like inside. It was more like it was on the arch, on the bottom part. So more towards the heel. And that's, again, when we talked about that dreaded plantar fasciitis, that's probably more or less what it is. Sometimes if we don't have proper flexibility in the actual arch of the foot or actually on the big toe, which is another thing that people don't really realize, or actually in the heel cord in the back of the calf. If the flexibility is not there, sometimes we can develop what we call adhesions or things where the muscle develops some tendinitis, where the transition zone from the muscle to the tendon, you can get some tendinitis there. To say that it's a cyst, who's to say? Yeah, and then again, working on decreasing activity, working on stretching as much as you can to get that flexibility back. What is it?
Explain more about plantar fasciitis.
Yeah, as far as plantar fasciitis, that's a tough situation. I would say, depending on your foot, because you can have a supinated foot with plantar fasciitis because you don't have enough flexibility and the actual bottom part of that foot is stretched too far. Or you can have plantar fasciitis with an overpronated foot because it's actually stretched too far out. It's kind of a double-edged sword, and it's more of, at that point, not treating with the shoe, but treating the actual problem itself. There's different modalities. I mean, again, seeing a professional to do that, the shoe is not going to change your plantar fasciitis. I can tell you that. You have to actually work on flexibility, stretching, and doing some actual soft tissue techniques to relieve that pain. But you actually won't change it with your shoe. I can tell you that. In the back. Yeah, the question was advocating inserts for cushioning. Again, for the appropriate foot type, more of a supinated shoe. But again, if it makes your shoe softer, as long as if you have an overpronated foot, that's not going to correct your pronation though, your overpronation. You want the overpronated, you want more of a stability shoe. But if it makes your feet feel better, I mean, that's fine. That's fine by me. I don't have any problem with that. You have a question right there?
Yeah. Running surfaces
Yeah.
soft stuff, it's always better for me. But if I did this, I'm trying to switch over. I read a book on barefoot running.
Yeah.
I'm using shoes, but I'm doing better landing. Do you think I could actually run on concrete?
The question was, he's trying to transition from a soft surface from, you used to be a heel striker, you used to hit your heel first. You're changing over to more of the mid-foot, forefoot strike. Could he transition to concrete? It is important. I mean, I think you definitely have to transition. Stay with your soft surfaces for now. And then, again, if you can do a mile doing your mid-foot strike on your track or the grass, don't think you can go and do a mile on the ground. You won't be able to do it on the concrete. Do like a quarter or a half of that. Start slower. That's a tough question. I mean, it's safe as long as, again, you're listening to what your body's telling you. I mean, if you're starting to feel pain, there's going to be more ground reaction force with concrete than I can tell you with the track or the grass, definitely. To say if it's safe, I run on concrete and it probably isn't that safe. There's not a lot of padding, and there's a lot of impact coming in through there, even if you're running on your forefoot. Yeah, that's kind of dancing around the question, I know, but.
No, that's a good answer.
You had a question? Somebody had a question up here. There you go.
Question about socks.
Yeah.
The socks are confusing. Thick socks,
You just put them on. No, I'm just kidding.
you got thick socks, you got thin socks, you got bamboo socks.
Yeah.
Socks. Some people I've seen about wearing 2 pairs of socks.
I like breathable socks. I like thin socks. That's if you're going to be exercising, you want your feet to breathe. If you're going out on a hike and it's 15 below, like this past winter was, you got to wear thick socks. You want your feet to be warm. It's a give and take on your environment that you're going into. Personally, I like thin socks, but again, if you want thick, it's more environmental. You want to keep your feet warm, but it's something thick and breathable. That's the name of the game. So you don't want your feet getting sweaty, and then you talk about the blisters, athletes' feet. I do too. Thin. I think try thin socks and see how they work for you. Yeah.
What causes calluses on the bottom of your foot?
Calluses is basically your wear pattern of your foot. So people, you go get your pedicures and you're just wasting your money. You shave down it looks good. You shave it down, it grows right back. It's your wear pattern. It's basically a bumper pad for the bottom of your foot. Your body puts it there. It lays down extra skin. Question.
Do you recommend cotton socks or synthetics?
A blend is good. A blend is nice if you can get a synthetic and a cotton blend. They're softer and they can actually breathe better. Mm-hmm. Yeah, orthotics that's a whole other ball game. But usually, the wear down of an orthotic is 4 to 5 years, and you always want to get your foot reevaluated. Your foot changes every 4 to 5 years. Everybody should know that. You need to have it reevaluated too every 4 to 5. Mm-hmm. Yep. Yep. Mm-hmm.
Yeah, the gentleman here was asking about thick or thin socks.
Mm-hmm.
What if you're diabetic?
Oh yeah. Whatever your doctor told you to wear. No, that's another thing is you want support and cushioning, but you want to be able to make sure you're feeling the surface you're walking on. Always make sure that you're looking at your feet. I mean, not that you have to do it every hour, but making sure that your sensation's good down there.
What about the price of shoes?
The what now? The price? The I know that does get expensive. That's one. I would say that's one of the things you got to take care of. Is you got to take care of your feet and having good shoes. I mean, sometimes it's worth. I mean, you don't have to spend the $300 on the new pair of shoes, but I mean, maybe to save up for the $110, $120 every year, I think that's well worth the savings. They are. I mean, they get expensive. They get outlandish. They really do.
Is it true that normal foot is slightly supinated?
Well, depending on what phase are you talking about? Like when you normally walk, the foot supinates then it pronates, and it supinates again. It tends to, a normal foot is a little bit more actually pronated than it is supinated. There's a little bit higher arch, but typically it's a little bit more what we call pronated, more rolled in a little bit. Yeah. Yeah, yeah, just slightly. Yeah, there needs to be a little bit, what we call, there's a bone in your foot, it's called the navicular bone. It's actually, we can go, well, it's one of the bones, it's, actually I can show it right here. Thank God I brought this. This bone right here, there actually needs, when you're standing, there's actually a little bit of a drop. It's called navicular drop. It should be less than a centimeter when you actually go from a non-weight bearing to a weight bearing. It needs to be less than a centimeter. If it's more, this is more technical stuff. If it's more than a centimeter, you actually have an overpronated foot. So a standing neutral foot is actually a little bit pronated. Mm-hmm. I would definitely say more of a stabilizing shoe, something that's, because I mean, standing, we get lazy, and we don't. When we get lazy, we don't roll our feet out. We tend to roll our feet in. So you want more of a stability, an overpronated shoe, something that stabilizes the midsole of your foot.
You talked a little bit about walking and its effect on the knees, and can you talk a little bit about that?
I mean, as far as walking, as far as.
Well, I mean, like, for instance, like I was out the other evening walking, and I walked about 4 miles, and I was walking on the street, on the edge of the street, by the time I got home.
Yeah, it sounds, the question was walking in relation to knee pain. It sounds like more not that the walking is bothering you. It's that if there's any development of any type of arthritis or inflammation in the knee, it's that because the muscles that haven't really been trained properly. It needs to be more of a strengthening accompanied with it, not just the walking. There needs to be more of a strengthening component that needs to be added to your program. Mm.
What about, are there things that you can do to exercise or stretch your feet? This gentleman talked about walking barefoot.
Yeah.
Are there certain things that you can do?
Yeah, absolutely. Come see me tomorrow downstairs. No. There's definitely stuff that therapists can show you, different exercises to strengthen the intrinsics of your feet, some of the lateral ankle stabilizers, some stretches. They can show you some soft tissue mobilizations you can do to actually work on the mobility of the ligaments and muscles of the foot. Absolutely. I didn't bring any with me today. I can show you some though. You have the next question.
Are people born with these defects?
Yeah.
Well,
Well, and that's kind of chicken or the egg too, is whether we've been walking like this for so long that we have developed more of a overpronated foot, and that's. But most of the time we're born with the foot type, and that's what we're stuck with.
You talk about your foot in terms of balance.
It's as far foot in terms of balance. Yeah, I mean, there's training exercises you can work on as far as single leg stance and balance. Not something I can really demonstrate. There's definitely some exercises that I can show you. I'm trying to think. What is it? Oh yeah, absolutely. I mean, there's different techniques you can really do. Yeah, there's not like once you lose your balance you can't get it back. You can. You had a question. Yeah, right downstairs, first floor. Yeah, we do all types of foot evaluations. I mean, and if you feel, I mean, we have 2 really good foot doctors, Dr. Laughlin and Dr. Barnett, as part of our practice. They're, yeah. Is there another one? Yeah, and again, that was a shoe I wore a long time ago when I ran. Yeah, I ran, and I wore those a lot too when I walked. So when a normal walking pattern, everyone hits lateral side of their outside of their heel. Yeah.
OVERPRONATION or supination, which one of those would be more detrimental for IT and
Supination. Yeah. Mm-hmm. Going once, going twice.
You mentioned every 4 to 5 years you put changes. How and why?
Just based on different tissues, strength, different breakdown of the foot. I mean, as I mean, we walked on our hands would do the same thing. It changes as we walk, as we change our lifestyle, as we exercise. I mean, it changes every 4 to 5 years. I mean, it's why? Just yes. This is my boss. This is my boss. So she's the one that talked me into all this stuff. No, this is Iva. Iva Stat. She's our other therapist downstairs.
One of the things to remember too is if you go into, and I'm not picking on any, I don't know anybody works for Dick's or Champs or place like that. If you walk into one of those places and say, I need a curved glass, multi-density
Yeah.
outsole with a heel counter and a stabilizer bar. Do you like this pink one? We've had some really good success. We don't have ins with any of them. They don't give us any kind of kickback to send. But there are several. If you have questions, you don't have symptomatic foot, you don't feel like you have pain or need something addressed. Some of the running stores, so the running spot up and running, of the big box stores, I do know that the Finish Line tends to spend a little bit more time training their associates. But if you go into one of those running stores, they're going to have you take your shoes off, they're going to have you walk barefoot on a treadmill, they are going to look at your rear foot, forefoot alignment, and they're going to make a suggestion to you, not based on whether it's a high dollar amount shoe.
Right. Right.
They're going to put you in the right shoe based on the foot. Now, you might not like the color. They might not have lights in the soles, but they will be the right shoe for your foot. And they are actually pretty good at doing that. They spend quite a bit of time. And relatively speaking, don't charge a great deal more for their shoes
Right.
than
What's the name of the store?
there are several here. I think it's Up and Running, The Running Spot, Runners in the Room, or
We'll find something. I think are we gonna send something out, or we're not sending? We'll find something. We'll get some websites of actual stores around the area we can send to you.
The type of shoes that you should put on, if you don't do that, does it cause arthritis?
If you
Like,
don't.
I mean, you know,
If you don't have the appropriate shoe, the proper shoe, it's gonna cause an uneven wear of your foot naturally, and knees. It's gonna cause arthritis up the chain. Yeah, absolutely.
So it's very important.
I think it's advocacious, definitely getting the right shoe. Well, it's not to say that you aren't going to get arthritis or degeneration of the joints. I mean, everyone does. If we stayed non-weight bearing the rest of our lives, we wouldn't get arthritis, but we wouldn't have anything else either. It's the nature of the beast. Is we are going to get arthritis. That's what it
So
is.
actually for children who are growing and their bones are growing, it's very important to give them right type of shoes.
Yes, alignment is key for us and for our little people. We're growing one right now.
So do they make so many types of shoes, right shoes
Yeah.
for the children?
Yeah, absolutely. Yeah, it's again just going to the store and seeing what type of foot your son or daughter has, and you can
They can
hopefully by this that you feel pretty confident
so
too.
they can,
Yeah.
choose them.
Yep.
And actually, little children, they are.
Well, yeah, little.
sometimes
Yeah, I would say above the
they
age
need
of
shoes.
6. Yeah, above the age of when they're still growing and changing. I would say above 10 to 12. Then you can start really looking at alignment and things like that. Younger than that, they're still growing and changing. I wouldn't worry about it at that young of an age.
Do you use shoes for like 1 year, 2 years old?
Oh yeah, yeah. I mean, but I wouldn't worry about what type of shoe it is at that age. Definitely not. Yeah.
Would it be possible that, they just walk in one foot hurts more than the other?
Yeah. That could be something going on as far as your alignment goes. Not everyone's both feet are the same. One foot can be an over-supinator and one can be a pronator. It doesn't say that one has to be both. It can be one side has to have the shoe, which again, that might be more of an orthotic that would help. So you don't have to wear 2 different shoes. That would look kind of weird. But yeah. If you guys want to go ahead and head out, anyone that has any specific questions can just come up and ask to me. But I appreciate your guys' time.